okay? We're going to watch, it has to be a minimally 550, okay? Which is why we always want to make sure that the suction is turned all the way up. There's no reason why this should ever be turned down. We want to have the maximum amount of suction, so we're pulling in as much tissue as we possibly can for the deployment. So once we've visually seen, hey, the pump is working, we're all set on the pump. So what we can do is release that and turn that off.
How strong is that suction compared to wall suction?
Probably not as much. I would say wall suction is probably more. Correct me if I'm wrong. So once we have confirmed that the pump is working appropriately, we've checked the tissue well, that little circle that's on the capsule there, to make sure that the trocar has not deployed yet, and make sure that the disposable in and of itself is not expired. We are pretty much all set to go. So this is some of the altitude stuff on the vacuum. So what we can do is now, this is the Bravo recorder, okay? Each one of these is associated with a specific symptom of GERD or reflux. And it will say that on the patient diary. It'll go through each specific one is like a belching, or they have chest pain or something of the sort. This one on the left here is for eating. These symptom buttons in between here are different than these two. These two on the sides, the most important part is we have to make sure we log when we start and when we stop eating. These ones in the middle here, from a patient education standpoint, that's just if you burp, you're going to want to click the one burp. You're not continuously burping for 25 minutes. Hopefully you're not burping for 25 minutes. So what we do when we want to start eating, we'll click that food button, and then when we click stop, that'll make sure and indicate in our software, hey, they started eating here, and they started having symptoms at this time. Same thing with the supine or laying down. We have to make sure that we're indicating when we're starting and when we're stopping. So if they're going to bed, we want to make sure that we click it, and then we click it again once we wake up. They take a nap, anything of the sort, or you're laying flat, whether they want to lay flat on the ground or a couch or a chair or whatever. They want to make sure that they start and stop that. Again, these are going to be your patient indication buttons here. So this one on the left is going to be chest pain, middle one is going to be regurgitation, and the square one over here is going to be heartburn. These are all indicated on the patient diary that we're going to be handing to the patient. We want to make sure that they log their symptoms not only on the recorder itself, but on this patient diary as well. What that makes sure is when we upload all of the study to the computer, we can kind of correlate, okay, they clicked this button or forgot to click this button. Typically what you'll find is they'll either be really good at pressing the buttons on the recorder, or they'll be really good at doing the diary. Typically it's not both. That's why it's so important to have both pieces to make sure that we can correlate and give the physician as much data as possible to make sure that we can rule in and rule out the reflux symptoms that they're having and what is correlated with. If they're eating tacos every day or enchiladas, of course they're going to have some more acid reflux and stuff like that compared to if they're eating more bland food.
Do they do a food journal as well?
Yep. So that'll be part of that patient diary. The second we take off the magnet off the Bravo capsule, we're going to have 30 minutes before the recorder will start recording the study. So we have up to 30 minutes before we need to drop the capsule and before the study will start. So typically you're not going to take that long. That time on the front end was typically used for the calibration piece of it. Now that we don't have to do that, the time that we take the magnetic piece off and when we connect it to the Bravo recorder itself takes about 5 minutes. So it's an easier process. You typically, once we get the go-ahead from the physician, like I said, that process takes about five minutes or so.
So from a procedural standpoint, would you recommend leaving that cap on until the moment we're about to put it in the patient? Is there any other delay that we're waiting on that needs to be taken off earlier?
No, but that 2 to 5 minutes always seems significantly longer when they're waiting on us when we take that wait for the physician if they don't have like esophagitis or if we get the green light.
So what's the 2 to 5 minutes?
So that's what yep, that's the second when we take the magnet off to when it's basically pairing to the recorder. So we just want to make sure that, hey, we don't have anything or contraindication why we wouldn't drop. But every time that, if we're waiting until the last second to pull that magnet off to start this pairing process, everybody's kind of just sitting and waiting for that, right? So, I typically...
Once the magnet is pulled off,
Yes.
it can't be replaced if there's a change in part about that procedure.
So it can be, but it would have to be used, that Bravo disposable would have to be used that way.
Okay.
So that's why typically, we want to make sure that we officially get the green light. We are going to drop it. That's when we open the disposable. We don't want to open it up any sooner to make sure that we're not wasting those in any way. Because when we did the calibration, we used to have to wait, Julie, was 30 or so minutes before the procedure, and then we'd go down, they had severe esophagitis, and then they're like, we can't drop it, and then we can't use it. So this is, gives us the ability to be a lot quicker on the front end and not waste as much disposables from a hospital standpoint. Once we go through the connection process here, what that's going to look like, it'll have a little button on this side. It'll say Start Study. What we're going to do once we get the go-ahead, we've removed the magnet, we'll click Start Study. We're going to click, it's going to go to another screen. It's going to confirm the date, time, and the length of the procedure. We want to make sure that is correct. 3 things that if you guys leave here, you guys have to make sure that are good to go before we do any of these procedures. There's a date and time that has to make sure that that's correct. If that's not correct, the study when we go to upload will be incorrect as well, and all the times will be screwed up. So it's really hard to interpret when we're doing all this. If the time is off and it's saying that she was eating or doing stuff at 2 a.m. and it's not correlating with the patient diary, so it really throws a lot of it off. So we have to make sure that the date and time and the battery is completely full. We do not want to send out any Bravo recorders that the battery is not fully charged. That is because if the Bravo dies, we're not getting any of that data, right? It's basically we'll have to bring them back in and do a whole other procedure. So those 2 are really, really important. Date and time, fully charged, and then of course non-expired. Once we connect it to the Bravo, it's going to give you an indication, hey, is this the Bravo capsule that is indicated on the Bravo recorder? That information is going to be all right here, okay? We want to make sure that that is confirmed. If we have more than one Bravo capsule and somehow another magnet from another Bravo disposable has been knocked loose, it can connect to that Bravo recorder. So if we drop the Bravo capsule, which has happened, and it's not connected to the correct capsule, there's not going to be any data recorded, right? It's just going to be blinking red at you the entire time, and we're not going to get any data, and they're going to have to go through this whole procedure again. So making sure that once we click Start Study, date and time, fully charged, and then that it matches up with the lot number that we have specifically on the disposable itself. Again, it can connect to other disposables if that magnet has been knocked loose or if we have a bunch in the room. Placing the capsule. So this is more so on the physician side. So oral placement of the Bravo capsule can be performed either using endoscopic measurement, using an endoscopic to determine the desired location of the capsule in the esophagus. Typically the capsule is placed 6 centimeters above the SCJ. Measure and record the distance traveled by this the scope in the desired location. So typically once we get that measurement, there are little tiny itty bitty numbers on the disposable itself. Once we get the numbers where the SCJ is and we subtract 6, what I typically like to do is actually take one of these or another piece of tape, take one of these little stickers off, or again you can use another piece of tape or whatever. But when it's dark in the room, it's really hard to see these little numbers, right? So what we want to make sure we do is wrap that piece of tape around the desired location of where that SCJ is subtracting 6. And what that do is then that'll indicate to the physician this is the spot where that's going to go all the way to the bite block, right? Again, when they're sitting in there and they're trying to deploy this, it's extremely hard to find where these numbers are and where we're at. So that's just a nice little tip that you can do for your physicians to make sure that it's being dropped at the appropriate number once we've indicated where that needs to be. Typically we don't do a lot of manometry measurements from when we drop it, but that's going to be 4 centimeters instead of that 6 centimeters from the endoscopically. Once we've got everything good to go, we've got all our numbers, we've got the measurement taped off, what we're going to do is we're going to drop this. Again, this piece of tape, or that indication where that disposable needs to be, that's going to be dropped, that's going to go specifically right to the bite block. Once we've deployed it, this little capsule is going to go tongue down. It's going to go tongue down all the way down to that measurement that we have. Once we've dropped that, what we're going to do is we're going to attach this to the suction. So we'll come over here, which will typically be a lot closer. Once we've dropped it, we've had the correct measurement, that's at the bite block. We're now going to put the suction tubing on, okay? And we're going to turn it on. It is 30 to 45 seconds of unimpeded suction. So it's typically kind of hard to do, especially if they're a little squirmy, if they're not fully sedated, or if they haven't had enough propofol. They get a little squirmy, right? I mean, there's something that's uncomfortable in their esophagus, right? So we have to make sure that it's at least 30 seconds of unimpeded. So unimpeded, they can't shake, they can't move, they can't try to rip it out, they can't cough, they can't do anything of the sort. What that